Did everybody have a good time last night? All right. So today is going to be a nice, leisurely, enjoyable conversation. And the discussion is going to be an important one, something that last night we talked about 50 years of gift of life, but today you're going to find out really what those 50 years were. If you could, these three of you over here, please. And we're going to give you different aspects of how we develop programs around the world, how we integrate our partnerships, how we integrate local teams, charities, hospitals, and give you a sense of what it takes to do this work. Because the mission of Gift of Life is to develop programs around the world in partnership with our autonomous Gift of Life programs, with our like-minded partners, and with anybody who really has a desire to make a difference in this world in the terms of the lives of children. And so last night was so special that we had representations, as I said, from 30 countries, 22 Gift of Life programs. I hope that last night I was as complete as I could be, but I did make one faux pas. There's probably more than one, but I made a major faux pas. And I left out a great man who has done great things in Tennessee. He started a program right when I was starting in 2008. He had began his program there, and they are one of the rare Gift of Lives that has been able to develop a relationship with the hospital and maintain that relationship for almost 20 years. That's special. Because most hospitals nowadays are risk averse. They don't really want to have to take a child in anymore. The cost is not cost effective, not a risk. But Bill Pickens, the founder and the head of our Gift of Life Mid-South, would you please stand up? I apologize to you, Bill. You didn't deserve to be left off. That's a great man right there. And his wife, Carolyn, is not with him, but she's blessed because I don't know how she puts up with you, but anyway. Thank you, Bill. I'm sorry about that. So today is going to start off with a great panel. We have three individuals who exemplify when we want to develop a sustainable program. We want an invested government. We want a supportive and partnered hospital. We have a team in place to empower and train, and an NGO on the ground to do so. So first up is Robbie Rambaran, and I've been working on that name. He's director of the Georgetown Public Hospital in Guyana. Great program that we have, very unique program. And the concept here is we're going to have three presentations, 15 minutes each, and then we want you all to have the opportunity for questions. Please, let's be interactive. We tried to make this, you're sitting in the room, sit over there. Try to make this as comfortable as possible and just have a dialogue. That would be great. So, Robbie, you're up.
Good morning, everyone. So, let me just check to make sure this is working. Is it? It was?
Yeah. Okay. At the end of the session. Thank you.
Oh, perfect. So, morning again, everyone. My name is Robbie Rambaran. I'm the Chief Executive Officer of Georgetown Public Hospital. This is in Guyana, South America, the only country also we consider a Caribbean country. It's government-owned. It's in the capital city of Georgetown. The hospital was established in 1838, and it was expanded throughout the years. It's at a 500-bed hospital. We have an average record of 200 visits a year, 26,000 admissions annually. It's a level 5 hospital serving as Guyana National Referral Hospital and its premier teaching hospitals. We have about 22 postgraduate programs in various specialties. Also, Georgetown Hospital serves as the regional hospital for Region 4. Guyana has 10 administrative regions, and it's also the district hospital for the city of Georgetown. And we oversee 5 primary healthcare centers. I'll go in a bit in that. So this is a little bit of our profile as January 2025. We have a workforce of 456 doctors, 899 nursing staff, and to be honest, we are about 47% of shortage in nursing staff. Allied healthcare workers is at 190. We have 26 inpatient ward, 19 bed emergency units, pretty small, a lot of constraints. We have 519 beds currently. The 5 primary healthcare facilities we have, there are 3 health centers and 2 polyclinics. There are also 9 critical care units, 2 IC adult intensive care unit. We have a pediatric intensive care unit. We have a cardiac intensive care unit as well. There are 11 operating theaters. We do transplant consistently in Guyana as well. And this is our care at glance in the end of 2024. We saw 26,054 inpatients admission, 236,000 plus outpatients. We did 13,856 surgeries. There's 21,209 cardiac tests, 8 kidney transplants, and we do 4,631 live births. We do almost 60% of the birth in the country. Why this partnership? I don't think I really need to speak much about the burden of CHD. It's been a sore issue globally. In Guyana, we lack the various capacity in terms of human resource. We didn't have equipment. And I must say this as well, which will complement this presentation, is Guyana is now considered the fastest growing economy in the world. In 2016, we found oil. So the advent of oil, there have been many progressive transformation projects. Currently, we are building 12 new hospitals. Even the hospital where I work, the national hospital, there's going to, starting very soon, we just had an election 2 weeks ago, and one of the plan is to build an entire new Georgetown Public Hospital. So there's massive health transformation is ongoing in Guyana. So we came a very far way from when we had basically all our equipments were donations from various stakeholders. But with the blessings of a bit more resource, we are able to procure more equipment and more state-of-the-art equipment as well. So this partnership started in 2015, and it had a hiatus. I really don't want to get political because I'm not a politician, but there were some difficulty. Rodrigo could tell us very much about this. There were some issues when there was a change in government in 2015, and the project fell apart. We started this back in 2023, but the discussion started in 2021 because of COVID. We couldn't have a fast track. But other than that, there was a lot of procurement because the equipment that we had prior, because of they are not being used, they all became more or less obsolete and unserviceable. So we had to start by the whole procurement process, procuring of equipment. We had to train up the nurses because many of the nurses that were trained, they left. So since 2023, we so far had 7 collaborations completed. There is one scheduled for December. And to date, we have completed 51 open heart surgeries and 20 CATS intervention. With this engagement as well, one of the things that we are doing currently that is ongoing, we're putting a second CT scanner, a second CAT lab. The impact of patients and their family, obviously it saved lives. I remember when we started this back in 2023 and we went to the press conference because it's a government-owned hospital, we hold accountability and transparency highly. So we wanted to inform them of what we were doing. And I actually broke down in the press conference because being a dad, seeing these kids go through this. It's one of my passion. So saving lives and access to care locally instead of overseas was what it was meaningful to us because it's very expensive to send the kids abroad, and then there are only so many kids that can be sent because of budgetary constraints. But having these collaborations, we have a visiting team ever so often. Obviously, this reduces the cost for the families because there's only so much government would have paid. Family would have had to pay for probably their own airfares and their accommodation, whichever country the surgery. And in this case, lots of the patients went to India. There were a few that came in the US as well. So this really improved our survival rate and the quality of life, give these little hearts a renewed lease in life, I love to call it. So, and also, it's not just doing the surgery. One of the main things we are looking at is to build, strengthen our human resource in terms of our surgical skills, upskilling our staff, capacity building. So there have been lots of ongoing training. We are also next week, we have a local who is going to India. He's going to do pediatric cardiac surgery training. So all of these were birthed from here. There's a plan as well to have a boost in postgraduate training because in our surgical postgraduate program, the residents from the general surgery usually goes to the theater when the teams are there, so that enhance their training as well. Strengthening infrastructures and equipment, I spoke a bit about that, buying new state-of-the-art equipment, echo machines and lots of other. Expansion of pediatric care, this is our future plan. In 2020, when the new president was elected, his mandate to us in the health sector was that he wants to develop a world-class healthcare system. And in so doing, he wanted Guyana to be the hub of the Caribbean. So focus on a lot of medical tourism, and a lot of specialized care. We are currently also building a cancer hospital, a center of excellence for oncology, and many others. So the focus is not to duplicate the resources in the Caribbean, but Guyana taking the lead because of the advent of oil, the newfound prosperity, so that we can have these a hub and spoke kind of methodology in the Caribbean. So our focus is to have Guyana as a hub for pediatric surgery, continue training and knowledge transfer, and sustain this program, but locally training all doctors, nurses, and like I said, we send a doctor to India. So in closing, I really want to thank everyone from Gift of Life, Rob, Dr. Rodrigo, and the entire team who had played a fantastic part in making this happen. For those who work in the government system, you know when things started and they fell apart, it's extremely difficult to get it back up. It's like you go 5 years back, but with that resilience and commitment from each one, from Goli, from my team back in Guyana, our president, the Minister of Health, this was achieved. This program is fully funded by the government of Guyana, and that's one of the beautiful things we have back home. It's a lot of the initiative so I've been around the hospital for 20 years. I've worked there for 18. It's actually 23 years, I worked there for 18. I was away for 5 with the World Bank. But I remember in my early days, I actually started working there as a clerk. But and I moved up. But in my early days, trying to get things done from a bottom-up level was extremely difficult. I guess many of us can speak about that. The good thing that we have now is that we have from the top, and I will say from the top, meaning our president, who is committed to make things happen, to transform healthcare, to transform every sector. I remember when I went back to the hospital in 2021, after they called me out of my lovely job at the World Bank, a job that I used to consider a permanent vacation. No, I'm serious. I was traveling the world and with nothing basically to do, and they decided to take me back to the hospital. And from that day, we started to engage many partners. And I remember we were engaging PAHU for many, I'm giving you this example, for many little electronic medical record software that we can put. We put one in the maternity, we put one in the emergency room, and one on the ambulatory care for internal medicine patient. And then he said to me, the president, when we were launching these things and he saw them in the news, one day he called me and he said, do you want a full-fledged electronic health record that we can spread it across the country, one patient or one record? I said, that will be fantastic, it will be costly. He said, consider it done. He picked up the phone, he called the minister. We had an ad out in the newspaper. It was a bid, company from UK, RioMed wanted. Currently, we are implementing this. So this is the kind of support we're getting. It's a top-down approach. So again, thanks to everyone here who has played a part. And I really, truly believe that the best is yet to come. And I have a short video here. Thank you.
Excellent. The concept of our discussion today is we're going to have all of our three speakers speak first. So as I did, if you would just write down questions you may have, I have a number of some fascinating aspects that we have in Guyana that we have nowhere else, and I'd like to talk a little bit later about that. But please write down your thoughts and your questions, and we're going to have the question and answer following each of the three. So Robbie represents the government/hospital part of our development of a sustainable program. The next part of it comes with empowering a team. And as we did in El Salvador, and two of our surgeons are here today, Dr. Gamero and Dr. Martinez, we work with the local team, with our training teams. As you saw last night, we have some amazing volunteers around the world. You're going to hear from a couple of them later today speaking. But our project in Bolivia started in 2018 with a screening visit. And it's grown into one of our most important programs and one that we give a lot of effort to. And the biggest reason we do that is we have a lot of faith in their leader. And their leader is here with us tonight, today. Feels like last night. And Dr. Ericka Perez is an exceptional woman, exceptional doctor, humanitarian. She's leading a program at a hospital that necessarily that was not welcoming of this program, but has fought and fought and fought for the children. They've helped over 500 children since she started this program 8 or 9, 10 years ago. You're going to hear more from Dr. Perez. She is a great, great partner. Dr. Perez.
Good morning. Thank you very much for being here and for all the work you do. Thank you, Rob. Thank you, everybody who works so hard to help children who are very far away. I am very proud and I am very honored to be here to talk about Bolivia. So I don't know if you know my country, but Bolivia is in the middle of South America. We Bolivians like to say that we are the heart of South America, and we are surrounded by very giant countries like Brazil, or very successful countries like Chile or Argentina. But Bolivia, as you will see, have different colors of, I don't know, luck maybe. We have some particular problems because we are not a small country. We are a middle country in area, and we have 3 different floors in geographically speaking. We have mostly 40% of very high altitude land that are named like Altiplano, where the people lives around 4,000 meters above the level of the sea. We have another, the yellow part of the country are valleys that have medium altitude, and the green part of the map are the Amazon, where the people lives in 1,000 meters above the sea. The problem with the poverty in Bolivia is hard. The map I am showing you is a global map where you can see that the color, because the color say too much, the color of Bolivia don't belong to the continent. The countries around Bolivia are growing very strong with problems, of course, but they are developing. But we have some particular problems about that. The millions of Bolivians that have Indian origin, and the poverty in that area is really worrisome. If you have a country with this problem, of course your kids are dying. This is also a very good map that you see how is Bolivia related to the continent, and maybe we belong to another. And why the kids are dying? They are dying because they are poor, but but because also they cannot afford the private system practice of health system. So the private system just reach 10% of the people. We have a second system that is mandatory insurance system just for the people who works, and that it's also very small percentage. And the most important part of the population doesn't have insurance system, and they belong to the public system. Of course, some governments created the universal insurance system, but the problem with this global insurance system is there is no fund. So with the same fund, they just sign that everybody has the right to have the health. So for the same cake, they divided in many parts, so the proportions are not very fair. Well, I work since 2015 in the Hospital del Niño in La Paz, Bolivia. That is a public hospital. It's a pediatric public hospital in La Paz. That is the principal city in Bolivia. And it's a reference center for the complex pediatric cases. In 2016, we started a program, the cardiology program. The cardiology program born for the thanks to the doctors, to the hospital, to the people who saw the needs. Because if we agree that 1 of 100 born children have a heart diseases, in Bolivia we are waiting around 3,000 children born each year with the heart disease. And at this point, there were no hospital, no public hospital for these children. So they were dying. 3,000 children dying because they don't know they had a heart disease. In the beginning, the program was working just with 2 beds, borrowed in the pediatric surgery unit, and with a lot of effort about the work in every kind of, in every area. There were apprehension and skepticism from the hospital administration and all the colleagues. So we faced a little bit struggling times, but I think we started with this program with funds for 15 kids. The other kids, we struggled a lot until Gift of Life became a partner for us, a friend. And as Rob Ryman said, in 2018 was the first screening mission for Goli. It was not so easy because everybody also in the world is afraid to be in La Paz, so high altitude, and maybe they also had some doubts, and I appreciate Rob Ryman have faith in us to visit the hospital. In that visit, we called to the population to bring the children, and we screened almost 100 patients, and I think 80% of these 100 patients had a heart disease. So I think Gift of Life, Rob, everybody who were there saw our needs. Happily, it was not planned, but happily, Rob could bring a second mission, a cath mission, and I thank also Ruth Nebiaran and her husband, because they were also very optimistic. They support us. Ruth is a very good Bolivian here that support our program. And we do the second mission, a cath mission, also with Abe Rodman, another Bolivian living here, that go to do the cases. And finally, we could have the surgical mission. And the Italian team was the first. They faced the high altitude with a lot of strength, and we were in a road that we needed to show the hospital, to show the parents, to show our colleagues that we could do very good job, and we need a lot. So this surgical mission showed the way we can go. Next, we have the Duke group visiting us, and it was very successful also. And finally, Dr. Rodrigo Soto, who is here, lead the surgical missions, and we did a lot till now. When I made this presentation, there were 12 missions. In this week, we finally did the 13th mission. And it was really amazing, and it is really important for us. We did also 4 cath missions and numerous screening activities. And the thing is, we do also screening activities in another regions of our country, thanks to Carla and Owen, who are here, that become also friends, thanks Rob, to help us to do that trips and to make a lot of diagnosis. Another particular thing I love too much is human-centered care. Fred Lee, who is here also, it's a leader of this program that grow a lot in our country, that make our attention, our practice, not just very well done, but with too much heart. Humanized care changed a lot our view of the attention of the patient. As I said, not just doing it well, but doing with care. Here I chose some pictures of the first course we have, and how they developed. We begin our activities doing some exercise to just fight to the stress we have, everybody in the health system, to become more efficient and more caring. This exercise can do by the parents and also the child. So everybody is better. They feel better and they do better. We have a lot of information given by the doctors, by the nurses, and here is our psychologist giving that information that is very, very important. And they do also a visit to the hospital to be more relaxed and to be more happy when they are in the hospital. The nurses also learn that the children need some play to follow the instruction. For example, we have here a patient who didn't want the oxygen, but the nurse put the oxygen at the adult. So they cooperate more. And the kids are allowed to interact each other. These things made some differences in the hospital. For example, after the first mission, the hospital said, okay, you need some place for your own. So we have now a cardiology ward, but the key was the opening of the new pediatric cardiac ICU, thanks to Gift of Life, that gave us all the equipment of this, because I think you all know that the patient who have cardiac surgery needs an ICU, and sometimes we are fighting with another specialties. The new ICU is just for the cardiac patient, and it's very nice, very comfortable, and very useful. Not only the missions are our support. We can reach support online with our partners everywhere in the world, and that makes a lot of difference, because in our daily work, we need the experience of the people around the world. This is a graphic of the evolution of the program. We started with less than 30 cases a year, and we start to grow up with GOLI. COVID was a huge problem for us, because the crisis almost killed our program. But thanks to GOLI, we can start again, and now we can do 100 cases a year, and we reach for 150 cases a year. And we did in these 9 years, we are going to the 10 years, more than 500 cases. And if we count also the cut cases, we are near the 600 cases. The evolution is not in numbers, it's also in complexity, because this in colors also, you see that we are solving many kinds of diseases. That is very important, because if there, of course, there are some more frequent diseases, but there are another. So we attend everything in Bolivia, everything we can. We don't have the dream that we can do everything, but we can do many things. And that is the outcomes that are very important also. more than 96% that have good results. So what are the goalie impact in our program? Of course, the number. I told you we started with 30 cases a year, and now we are looking for 150. We couldn't do that without goalie. It's not the missions only, but the support in between missions with our daily activity. The equipment, the experience the teams share, the inspiration, the confidence we can build, the knowledge transfer, the team, the local team enhance their capabilities. We have also the need to strengthen our infrastructure. Also, we have social impact. As we said before, it is different to send a child to be healed in a strange place, but it's totally different that we can heal the child in their own environment, with their parents, with their pets, it is very important that, so the community have trust us a little bit more, but trust us. So also have a cultural change in the hospital, because they saw that we need a commitment to the excellence, and we need a teamwork. And at this point, we have a national recognition, because we are the center of reference in Bolivia. Of course, we have a lot of dreams. This is an AI image that I imaged about a national cardiology institute that we need in Bolivia, of course. But in between this dream, we need to grow a lot. We need, of course, a cath lab. We need an operating room very special for us. We need support. We need to grow, no? But I think we need to inspire the commitment of our leaders, and that's what we are trying to do. These are some pictures of our teams. We have the operating room team. We have the ICU team. We are here celebrating, I think, the 400 kids in the world. So we have pediatricians, surgeons, anesthesiologists, intensivists. We have very large community of people committed to this project. And here is a video for a very special girl. It's not a video for just this lecture, but it's a video that made the people there, because they are very proud of their work. We had a very difficult time with Emily. Emily is the name of the girl, but finally she went home. And you will see she's struggling with the breath, but you will see then she will be dancing and will be singing, because she loves to do that. And now she's with her family. Look, her dancing. She's lovely and represents our children in Bolivia. Thank you, Gift of Life.
You know what I said earlier, leadership makes a difference, and we have a great leader in Dr. Perez. Thank you for that beautiful presentation. Again, hold your questions. I've been writing down so much to talk about here later. Our next speaker, and the last on this panel, is a very unique part of Gift of Life's network. I first met Ivonne when we visited the First Lady in El Salvador in September of 2009. And Ivonne was this very young staff worker in the Inclusión Social. And the other people we had set up the meeting with at the table did not even pay attention to Ivonne at that table. And it so turned out that Ivonne was the best one at that table. And we are very, very fortunate to have Ivonne as part of our network, part of our team. What she has accomplished in that country is remarkable. She's our leader there. And I get a little emotional because, this is not about, we talk about, it's not about one person making something happen. And as we're going to put this whole panel together, it's everybody's individual effort that comes together. But there are people that help to make it happen and to inspire. And Ivonne Lopez is one of those. She's the founder of Latidos de Esperanza. She runs our Gift of Life program in El Salvador, and she also runs our child placement program around the world. When a parent reaches out to us on our website, it's Ivonne that gets in touch with the parent, works with the parent, and finds a solution for that child. We're very proud to have Ivonne part of our family, and I'm looking forward to her presentation. Ivonne Lopez.
Thank you, Rob, for the introduction. Good morning, everyone. I hope you had an amazing night yesterday. I definitely did. So congratulations, Rob and Brenda and the board of directors for organizing such an amazing night.
Thank you.
It's an honor for me to be the one talking about El Salvador's program. I'm going to take you through a 15 years ride. So I've tried my best to make it short because we have done so many things, but I'm going just to highlight the most important ones. But let me first start by talking just a little bit about my country, because I think these are some of the reasons why Gift of Life chose El Salvador in 2010 as their second country of focus. So El Salvador is the smallest country in Central America with just 21,000 square kilometers. And the good thing about this is that we have beaches, volcanoes, and you can visit all of this in one day. We have the best sunsets ever. We have 40 active volcanoes, a little bit dangerous, but we are getting used to that. We have beautiful lakes. Just renovate downtown. And we have the best typical dish. Which one is it, Rob?
Say it. Pupusa?
Pupusa, yes. So Rob has been to El Salvador like 100, 200 times, I don't know.
150, actually.
150. Yeah. And he can only say, hola,
all right, let's not go there.
Okay.
We don't have to do that. I can't speak Spanish. Un poquito.
Un poquito. But you know what? What makes our country really special is our people. We are just so friendly, so welcoming, so humble, and we are very hard worker people that we don't go to bed without eating. We have that saying. But most importantly, because our families, the children, they're just so special, so grateful, even when the outcomes are not the best ones. They always have a smile on their faces, even in difficult times. But equally important, because of our team of doctors and nurses, Dr. Francisco Gamero is over there in the crowd. A Gift of Life saw an opportunity right here. They saw that we had a team of doctors already trained, and a team that was committed and eager to make this program grow. These are some of our staff. Dr. Guillermo Martinez over there also with us. And so all of this, I'm sure that Gift of Life fall in love with our program and decided to invest in it. So we have 6 million people in El Salvador and 1 million living, or here they are telling me that we have more people here living in the US, but the information that I have is that we have 1 million
Not
Salvadorans
anymore.
here.
Not anymore.
Yeah, maybe. So we have, 1,200 children are born in El Salvador with a congenital heart defect, and around 50% of this number will need some sort of procedure. So when Gift of Life started in El Salvador, the team was performing around 80 children per year, and a lot of them were doing through missions. So how did Gift of Life started in El Salvador? So in 2010, they sent 117 children to 13 different countries, and they did this in order to raise awareness and also to get the funds to start with the program. So a strategy was developed together with the Ministry of Health, the authorities of the hospital, and the team, that 5 training missions were going to be done per year. Supplies and equipment were going to be donated. Doctors and nurses were going to be trained, and also a local nonprofit was going to be established in El Salvador. And that's when I appear in the picture. I was not 15 years old, but to make that clear. But so in 2011, Latidos Esperanza was founded, and thanks to my parents, my friends, like all my families involved in this, and thanks to Gift of Life, we have our Salvadoran nonprofit organization. We have our own board of directors, which some of them are also Rotarians. So after 7 years of so much hard work with meetings with authorities of the hospital, the Ministry of Health, and trying to build a case of the importance and the impact of a cardiac program, we were finally authorized to create the first surgical ICU in our country, dedicated mostly for cardiac patients. And also in 2018, we were able to remodel the general ward, and also we were able to have a space assigned to cardiology. So let me show you the video. One second. Dedicated for pediatric cardiac surgery in the country. The investment in the unit was $200,000, which corresponded to equipment, vital signs monitors, ventilators, infusion pumps, an electrocardiogram, and expansion of the gas network. In addition, new furniture, new lighting was installed, among others. The upgrade increased both the number and complexity of pediatric heart surgeries, reduced waiting lists, and ensured safer, higher quality care. Today, the surgical ICU stands as a testament to vision, perseverance, and the power of coming together for something greater. Because behind every safe heartbeat is a story of heart that made it possible. In 2018, the general ward of Hospital Benjamín was remodeled and equipped. The project included a play area for children, colorful wall murals, new ceiling and lighting, new furniture, and the reorganization of spaces to ensure better and more efficient care. As part of the upgrades, an exclusive cardiology area was created, equipped with 5 high-quality beds and medical equipment, including monitors and a cardiogram and other essential equipment. This renovation aimed not only to enhance medical attention, but also to provide a child-friendly environment that supports both patients and their families, offering comfort, hope, and a positive space for recovery. Today, both projects stand as a symbol of life, hope, and a brighter future for all Salvadorans' children. So this video gives me goosebumps.
Yeah.
Because it was not easy to get there. It was not, the money was there, but it was just to have the spaces available for us to do what we did back then. And this was like an after and before, because after this, the program actually started to grow. So there were like 2 very important projects for us. So, so while we were doing all of this, we were also donating at the same time equipment. We were able to fully equip the OR with, OR lamp, OR table, monitors, perfusion machines, sternal saws, instruments. And after 14 years, now the hospital has renovated all the ORs again and is fully equipped with new equipment. So through the years, we have donated $1.8 million in supplies and equipment. One thing that our program is very special because we don't only focus in the National Children's Hospital, but we also focus in two very important hospitals in the country that are in the west and eastern side. We have each hospital has a pediatric cardiologist, so we also have donated equipment and supplies to those hospitals to make sure that our help is it's national. One of our most important programs, I would say, is a training program. We have trained 46 nurses, and anesthesiologist was trained in Mexico, fully sponsored by Gift of Life. If 3 nurses were trained for perfusionists. Of these, 2 were sent to Argentina. One cardiac surgeon was also trained by Gift of Life, and he went to Italy for 1 year. So now our team has 2 fully time anesthesiologists. We have 4 perfusionists. We have 4 cardiac surgeons, and 1 is coming next year from Mexico, so we will have 5. And we have 5 cardiologists. So we're talking about like a team from 30 people. So we also have a very special training program, which is the Humanized Care Program. This has been led by my dearest friend, Fredly Kaplan. And I won't talk much about this because I'm sure that she will talk about this more. But I just want to acknowledge all the effort and all the love that she has put into this program since 2011. She has been going to El Salvador like around twice a year, training nurses, residents, doctors, social workers, among others. And right now, well, I'm very proud to say that finally there is a committee in place at the hospital that is fully supported by the Ministry of Health and Bloom Hospital. And Bloom has become like a benchmark for other hospitals of the country. So the Ministry of Health has created a group that is going to be the one teaching to other hospitals how to start a humanized care program. So I'm very proud of Fredly because I feel that she planted a seed that now has like grown exponentially. So that committee that is over there most of them are the ones that Fredly trained through the years. So in 2022, the government bought and installed a brand new cath lab. They also bought in 2023 2 new perfusion machines. We're talking about an investment of $3 million. Right now, the government is investing a lot in the cardiac program because this hospital understands the importance of having a good cardiac program for the country. And actually, we received children also from Honduras, from Belize, so yes, from all over. And health in El Salvador is free, so all these children are receiving the help for free. This is the cath lab, the new one. So by 2023, the team already had all the equipment that they needed. They had fully time doctors and nurses, and at this point, they were doing around 200 surgeries and 100 cath procedures. This is where the magic happens. This is our beautiful hospital, Hospital Nacional de Niños Benjamin Bloom. It's the only children's hospital in the country, and I would dare to say that it's one of the best ones in Central America. And these are the people who makes the magic happen. This is our team of doctors and nurses, plus Gave Owens and Fredly, but they're part of the family. So what are we doing now? Right now, we are doing 2 training visits. We're doing an electrophysiology mission where we treat 25 children. This mission is amazing because we don't have electrophysiologists. So with this mission, basically we go through all the waiting list. Then we have another special mission, which is an open heart surgery. This one is done with the help of the University of Michigan, led by Dr. Gabe Owens and Dr. Rico Ye. This one is amazing because through this mission, we're able to do the most complex cases that no one dares to do. We also do, during the whole year, cath procedures. We also donate supplies, especially perfusion supplies, because those are the ones who are more expensive and not always in El Salvador you can get them. And we have another very special program that is a nutritional program. We have done this since 2011, and we have helped 268 families through this program. So right now what we are doing is that we have a partnership with the nutrition department from the hospital and university from El Salvador. So they send every day a student to the cardiology service. So the cardiologists refer all the children to this nutritionist, and if they're malnourished, we provide them with supplements like Pediatric, carbs, etc. So the goal of this is to try to make sure that the child gains weight before the surgery, so they get like more prepared for it. So during 14 years, we have helped and impacted the life of 2,500 children. It's crazy. And a new era has come for the program. A dream came true last year when a group of Salvadorans went to San Pedro Sula in Honduras to do a training visit. And this was a dream that Rob had since 5 years ago and finally became a reality. And he is a firm believer of the abilities and capacities of our team. And his greatest desire has always been to show to the world how successful our program is. So I think this was a very amazing experience for them, and something that Rob has taught me through all these years is that our most important resources are the people. And he has made sure to always focus on the doctors, on the team, trying to empower them and try to make them feel as part of a team. And I think this mission made that happen. So it was very brilliant. So, just to close my presentation, I just want to say that nothing would have been done without the help of Gift of Life International. They have allowed us to have access to unimaginable funds, like from Rotary, from HeartGive. They have allowed us to have access to experts, to supplies, medicines that we cannot get in our country. And so thanks to this partnership, we have been able to multiply all the impact and therefore to help more children. And me personally, it has been an amazing experience, a partnership that has allowed me to meet so many amazing people, and it has been quite a 14 years ride, but I'm so grateful to be a part of it. And well, I even met my husband through the organization, so. So thank you so much for this opportunity, Rob, and everyone here.
Thank you. You know, when I first put this panel together, I thought it would be good. It was amazing, and I want to thank all three of you. You were amazing. Can we turn the lights up for a second? So, you know, just to talk a little bit about the three presentations and get us into the question and answer. The reason that Gift of Life and I went to El Salvador so often wasn't the mountains, because they are beautiful, wasn't the lakes, because they are beautiful, the sunsets, sunrises, the pupusas. It really is the people. And I want Chico and Guillermo to stand up for a minute. Can we turn the lights up, please? Okay, these are two guys that when I first went to El Salvador, thank you. When I first went to El Salvador, I met with them, and I was told, you're not going to succeed in El Salvador. It's not going to happen. And after spending a couple weeks with these guys and some other of the doctors there, I realized it was going to happen. And I think the reason I went so often, you guys can sit down, it's okay. Sorry. But the reason that I went so often is because I felt we had to prove these people wrong. And the importance of it was this, is that that's how people, the way I viewed it before we started, that's how people would look at going to a country. They wouldn't look at the people. They wouldn't look at what the resources were. They would look at what they thought the situation was and what, honestly, what made them better going in there, not what would be better for the people that they work with. So our strategy right from the beginning, and every Gift of Life program represented in here, and everybody who's ever been part of what we do, this is the essence of why we succeed, what you heard here today. We respect everybody in the country that we work. We understand that without them, we can't succeed. And the fact of the matter is, they know better than we do. And it came through. Look at the quality of what you just heard, these human beings who live it and are the reason why we succeed. So I have a lot written down here for questions, but I've been asking these questions for 18 years. This is your opportunity. Caitlin, are you out there? Okay, Caitlin has a microphone. If you could please raise your hands. Caitlin's very quick. She can get to you fast. But I really hope that you were keeping track of this because I don't want to be the only one asking questions. So first question, please raise your hand. Robbie, what did you want to say? Well, I want to get started here so that everyone's shy, it seems like. So Caitlin, can you bring Robbie the microphone? Because I know he has things to say. And he did not get enough time last night to talk. So
Good morning. Good morning. I will say one thing. I'm writing down ideas for myself and how we can go forward. This has been very fruitful for me. I'm not going to share them now until I share them with our board because I think we can do even better than what we have. But there's two elements that Rob touches on. One is a belief, and Rob has put teams together all over the world. And the belief in the program is, and the people that he has selected and he has put together is an important part of this. The first development program that we did was in Uganda. And we went there, did the promotion, and we came back to do a needs assessment. And the team there was really not prepared because they didn't believe in us. They didn't believe that we were coming back. And I remember telling the doctor there that we came back because we believed in you. So the belief goes both ways. And we appreciate the fact that you put your faith in us to back you up. And faith is the second thing that has been touched on. We have the faith that this is going to go, it's going to succeed, and we're going to continue to make it grow. And it's not only going to stay in El Salvador, in this case, it's going to spread to regions beyond that. I have no questions.
no question.
No questions.
Okay, does anybody have a question?
Right behind you. Behind you.
Hey.
Mr. Nathan, Bob Nathan.
Bob Nate.
Sure. I'd ask anyone that wishes to respond to this question. Gift of Life provides training. Gift of Life helps in every regard. What role does remote learning, what role does remote expertise and technical assistance play? Let me be more specific. Many times, surgeons run into difficult situations one would never expect to occur. Does your Gift of Life chapter have access to that technical expertise through the Gift of Life program? That's my question.
Ericka, you want to talk about that?
Well, thank you very much. In the case of Bolivia, we have the lack of having Gift of Life at the reach of the Zoom call. And thank you to Rodrigo Soto. We have a device that can project the echo images in real time for the experts in every part in the world. That was a very nice instrument and very useful because our cardiologists and our surgeons can discuss with people far away. So when we face difficult case, we can call Rodrigo or Harm or another doctor who want to help us. In fact, the girl I saw you the video on, it was a very hard case for the ICU personnel. So I called Gabe, and we set a meeting with my team because my team was very pessimistic, and Gabe gave gave us a lot of hope and a new vision about the case, and they inspire my team not to just surrender about the situation. So I personally feel very supported. Of course, they let us do our best, but sometimes we need the advice, we need the support, we need the inspiration, and there is no emission there. So that's important also to have a program in the place, no? Because you won't have a case just when the mission is coming. You can have a case anytime. So that is very nice for us to have this support.
Thank you. Good question, Bob. Thank you. Great answer. Any other questions we have out in the audience? Gentleman in the back with the hat. I know who you are, but I'm just. You want to introduce yourself?
Do you have a support system for the parents before and after the surgery? Because I believe when you go into a surgery, it's a risk. It's not always 100%. And that support system, personally, I feel should be coming from the people who speak the language and who understand what is in detail as far as the surgery. Thank you.
Ivonne?
So in El Salvador, for example, during the missions, we have some moms that has been benefit through our program, and they come during the day to give that emotional support. And also through the Humanized Care Committee, this team is always on call in case the family or a child need either emotional or spiritual support. They are there just to help. Bloom Hospital also has a very nice program called Ludoteca. So this is a group of, this is another nonprofit who has a group of psychologists that they go to each floor to do plays with the kids, obviously clinic, like sensory plays or like therapeutic, how do you say therapeutic?
Therapeutic.
Yes, therapeutic plays with the children. So they help a lot in these regards. And also through our nutritional program, we're able to monitor the children before, during, and after. And actually, this is why we have that program, so that we are able to evaluate them and help them through all the way.
You know, it was a great answer that Ivonne gave. And Eddie, the humanized care, which we keep on talking about, and Fred Lee is going to talk about it much better. And as I loved your idiom, your English idiom, dare I say, that was excellent. About dare we say we would know more than Fred Lee about this, and we're going to wait for Fred Lee. But a concept of our work is that we really do rely upon our teams in the country where we work. That is our strategy, is to empower those to care for their own. And we do not see it as our role to be replacing that. We see it as our role to supplement and to grow that. And so all of our programs, and you know, Ericka could go into what we do in Bolivia with Carla, amazing stuff, working before and after. But I'd rather let Fred Lee talk more about this issue. because it really is something very important for us. But we really do respect our local partners and rely upon them greatly. Next question. Yes, sir. Harm, you got a question?
I have a question.
Okay.
No microphone.
You got a booming voice. It's right there. It's right there.
All right, great. Thank you. Thank you. I have a question about Guyana. So from the outside, it seems to me a fascinating story how Guyana is rapidly changing its economy and the way the country is run. And my question for you regarding to healthcare, now that the economy is picking up so much, are you better able to retain healthcare professionals or even bring back healthcare professionals that have moved to other countries in the past?
That's a good question. I often say we can build all the fancy infrastructure and the state-of-the-art equipment. They will all be useless if we don't have the human resource to go with it. Guyana is very huge. It's 83,000 square miles. We have just under 1 million population. So in 2023, the president himself made his salary adjustments and other benefits to healthcare workers. So by doing that, intensifying, it's actually slows down the attrition. Lots of our nurses, especially, were leaving to go England, and now we're not seeing that happen. Our salary is almost on par with what they are receiving in England. He promised another adjustment, hoping that happens soon. And not just their salaries, but other benefits like the nurses, after so many years of service, they can actually procure a vehicle and get a duty-free concessions of all taxes off. So there are lots of other incentives that are being put in place for the retainance of our human resource. The doctors, they used to migrate it a lot, but they don't anymore because of the postgraduate programs we have. Their salaries on par with the rest of the Caribbean. So while we have a shortage, we have a severe shortage, we are training, we are willing to employ, but obviously there's some employments really need skilled people, you know, like a pediatric interventional cardiologist we don't have. We don't have a resident cardiologist, but we have one on payroll who's in Suriname, and he will come and he will collaborate with our team there to do screenings, and he will come ever so often prior to every collaborations that we have. But while we have the funding and we are willing to employ, sometimes attracting people to go to Guyana, we used to attract a lot of people from Cuba. We still do. We have a large Cuban workforce, but some of the bilateral agreement with Cuba and Guyana had to be put on pause because of other geopolitical issues. So we are at a satisfactory level of retainance in terms of their salaries, remuneration, and compensations. But there's a bit more to go. And I think we're heading in the right direction.
Ahmed.
With the follow-up on the question that was before, have you thought about providing some services in a virtual manner now that the internet, AI, etc., sending a mission is very noble, but it costs. Have you thought about doing some virtual missions?
Virtual.
Yes.
So we often, I mean, many of the times we get away from having visits when we believe that the program is to a certain level. That is, our goal is to make ourselves, not needed anymore, and that's really the truth in El Salvador. The only reason that Michigan still goes there is that they love El Salvador and they love the people. And they do some very difficult cases and they help out the team there. But they don't need to go there anymore. But virtually we do this all the time. I mean, Harm is on the phone constantly with different countries and working with them on either evaluations of patients or how to handle situations. Dr. Perez referred to consulting on a patient they had. We develop strong relationships, Ahmed, with respect that really stimulate that back and forth. And as Ivonne alluded to, we send out for training so that they can get trained, get immersed, and come back. And the greatest resource we have are our partners in those countries. And what I'm so proud of our network has done is that we have realized that and respected that. What has happened in Bolivia is an amazing success story. Rodrigo, Dr. Soto was just there with the team, and everybody commented. We hadn't been there in a year on how it had grown. and how everybody was doing so much more independently and with real assured, able to take care of the children in a very assured way and a lot of confidence. So virtual is playing a larger role as we stop those visits. I like that question. It really is excellent. Nola, you had your hand up? Nola? You had your hand up? Okay. Hold on. We got a microphone coming.
Thank you. I'm Nola. I'm from Jamaica. And I was very intrigued. Well, it's lovely to be here, firstly. It's just amazing to see and to hear the work that has been going on with Gift of Life and its other partners. But what I wanted to ask about, very interesting for me, was the humanized care program that one of our speakers spoke about. Very, very keen to hear some details. So I'd love if someone could just give us some more details on that, unless we have a speaker that's going to talk about that specifically.
So not being able to see Fred Lee Kaplan over there, I'm sure she jumped out of her seat.
All right.
But we are going to wait for Fred Lee to speak this. We see we're building up your talk. Wait,
Yeah.
just wait a second. I'll get to you. We're building up Fred Lee's talk. She really is. This is a very unique approach that Fred Lee came up with when she first visited El Salvador. So we will give Fred Lee a minute now because you have a lot of time later. Caitlin, could you bring a microphone over to Fred Lee, please? Thank you for the question, Nola.
Thank you. All the attention that humanized care is getting right now really demonstrates what an impact that it has, which is really a process of providing compassionate care so the children, families, and staff feel emotionally safe and are comfortable. Safety and comfort and empowerment are the words that's our thrust. So I want to thank our gentleman here, I'm sorry, didn't catch your name, for asking about parent support, because the moment they come into the hospital, the surgeons and the cardiologists and a psychologist will meet with them. And I'll go through what the process is.
Excellent, Fred Lee. Thank you. So I got a question for you. It's 10:15. We're supposed to take a coffee break. Do you want to work through that and go into the next panel, or would you like to get a coffee break? What do you want to do? Coffee break? Okay. So we will stop questioning here, but and we will end this panel. I just want to make a final statement. You guys would bet. You can wait till I make the final statement before you leave. This was a great panel, and I want to let's applaud them and thank them. And this is a key. People ask this question all the time: how do you decide where to go? How do you make the decision to go to one country or not? And it's those 4 principles that are our principles that we've had. So it doesn't look like it's a subjective decision, but it's a very strategic decision. We have a hospital that is invested, that's supportive. We have a government that is supportive and invested. We have a team to empower that we believe ultimately can do the job, and we have an on-the-ground NGO. There was no better example of those elements than these 3 human beings up here on the stage. I want to thank you guys for being my friend, the humanitarian effort, and our partners. Thank you. Okay, and Ericka wants to give a quick gift. Ericka, you want to? I didn't realize you were so loquacious here. You really, wow.
Well, as it is the birthday of Gift of Life, in Bolivia we used to give a gift,
Yes.
very small and humble, and it represents our care, our love for you. Thank you very much.
Thank you.
Happy birthday.
Thank you. Thank you so much. It's beautiful. Okay, coffee. You can go have your coffee.